My name is George Young. I'm a ASSE certified Legionella consultant and expert. I've been doing Legionella testing for 24 years with environmental safety technologies for all of our healthcare partners here in Kentucky and around the United States. We have been providing those types of services for almost 40 years now through EST. We're a certified CDC elite laboratory that provides for Legionella testing and other microbiological testing. So hopefully that gets you enough background information, and I really appreciate you guys having me on to talk about Legionella and water management plans and how to execute those. So as we discussed yesterday, one of the issues is the city water has Legionella in it with possibly very low numbers. And once it gets into your building in different areas, it could proliferate in biofilms. And those biofilms will allow for Legionella to get into the water system at higher numbers. And then once those aerosolize, they get to individuals, and that is where you get infection. Or that's your vector of infection for Legionella. It's not a person to person, it's a building system to individual type of infection. There's 50 different species of Legionella. We like to talk about Pneumophila because most of the disease case come from those. However, CDC and other organizations have started to look at all Legionella because it's a little difficult to discern the different species and which ones have disease as your issues. Legionella can live in building water because it provides good environment for it. It can be warm, not too cold, not too hot. Those Legionella can proliferate in biofilms, as Julia discussed yesterday with how those biofilms form in your premise plumbing systems and how those proliferate from that point. So multiple areas are of concern for your vectors to get to your individuals. Cooling towers provide for mist that can get in airborne and be breathed in that way. That's your main vector that most people understand. We know that cooling towers are bad and that they produce mist, that mist can have Legionella in them, and that can get to an individual. Your first outbreak at the Legionnaires Conference was from a contaminated cooling tower that was providing drift and droplets directly onto individuals as they exited the hotel. But we also can have issues with potable water systems, whether it's a shower or a sink. The splashing that you create when you wash your hands, or the shower itself, can aerosolize those, and you can breathe those in during that time frame. Additionally, with the hydrotherapy pools, the action and the activity that takes place in it can provide for that aerosolization as well to get to the individuals, along with decorative fountains and water walls. The famous chart that everyone shows where we continue to see an increase in Legionnaire's disease since 2020, and that number continues to go up. A little bit of it is recognition and testing. A little bit of it is the plumbing systems and their designs and starting to get away from some of those designs that may be causing or helping to proliferate Legionella at this point. So we talked briefly yesterday about, well, what CMS has your conditions of participation in and what kind of rules and regulations. And before ASHRAE 188 came out and was finalized in 2015, there was a patchwork of regulations, whether it was the ASHRAE Standard 12 that kind of mentioned Legionella, or some local registrations, the Cooling Tower Institute having some words to say on it. But ASHRAE 188 in 2015 collaborated and brought all of that together and put a cohesive plan together for how you can look at your water systems and minimize the risk associated with those. Like any ASHRAE or ANSI standard, it's updated on a regular basis. It was updated in 2018, and then most recently in 2021, meaning that this year it'll be up for review again to see if there are any changes that need to happen to it at that time. 2015 happened and 188 came out, took a little bit, but there were reactions at the end of 2016 and as you got into 2017, where CMS noticed that there was not a consistent usage of water management plans. The CDC provided guidance with developing water management plans, referring you back to ASHRAE 188, and the CMS then put out a memo that said you need to have a water management plan for your facility as a condition for participation with CMS. And that talks specifically about Legionella, and the requirements were to help prevent Legionella infections, that you had a plan to inhibit the microbial growth in your systems, and how that came about. The surveyors were then instructed to look and review policies and procedures specifically for do you have an ASHRAE 188 water management plan or a CDC toolkit, which is essentially just a reprinting of the ASHRAE 188 water management plan and the steps involved in that. And so the main point I'm going to be covering is why or what the steps are to get that water management plan created and done. So one of the first questions is, and it's kind of a chicken or an egg, there's a step 0 where you try to determine if your building is in need of a water management plan. The step 1 is to develop your team, and you would think you develop your team and then you determine if you need a building, but you're not going to develop a team unless you're building requirements. So fortunately, ASHRAE 188 provides for the building requirements, or the buildings that should have a water management plan, thus the ones that can have a problem with proliferation of Legionella. Number one, the reason we're here, healthcare facilities that have 24-hour or greater stays. That's the number one that gets us to why healthcare facilities are doing it. The second one that I wanted to highlight is treatment areas for burn oncology or BMT. Those are, medical office buildings and or procedure facilities or surgical facilities that are providing that care. If you have known immunocompromised occupants, that's another one of the conditions for having a water management plan. And then the non-healthcare related ones are multiple housing units with a centralized hot water system, housing for individuals over 65 years of age, buildings with 10 or more stories, both above and below ground. So if you have 2 below and 8 above, you count for that 10. And then facilities with cooling towers are the ones that are typically seen. So we had this question of, what about our MOBs? So when you look at your MOBs as part of whether or not you need to address them in your water management plan, the first answer is yes. Even if you just address them and say, hey, we've looked at them, we've assessed the risk, and we're not going to do anything with them, they need to be as part of your water management plan. But if they hit any of these other requirements for burn, oncology, immunocompromised, you would need to, at that point, have a full water management plan section devoted to those MOBs. So this is the figure 1 from the water management from ASHRAE 188. It tells you the 7 steps that you need to go through and how you go through them in order. I've heard that infection prevention is like flowcharts, and so this was developed by the CDC to kind of visualize those 7 steps as well, and in the same order, but in more of a flow of how you get from one to the next. So the first one is you have to develop your water management plan. So there are 2 routes that you take. Most buildings follow ASHRAE 188 and comply with the main body of that. They put together a program team, and that is their management team. Healthcare facilities actually follow what's called normative complex A. When 188 was in development, healthcare individuals, and both members of ASHE and members of APIC, were on the team to determine if there was going to need to be different functionality for healthcare versus most general buildings, and whether or not that was needed. And that's why normative complex A was, normative appendix A was developed. And essentially, it follows along the same lines, given that it turns a little more of your risk management over to the facilities versus following a the guideline that 188 is providing for that risk management. But it is a designated team instead of a program team. But that team is put together as part of this step one. Now, who needs to be on the team? This has always been a question of, well, is it just infection prevention? Is it just engineering? Is it risk management? It starts with administration and risk management. You need to have someone in the C class or the C-suite that can sign off and pay for, authorize some of the changes that your water management plan is going to have. And your risk management team is going to be involved in ensuring that is in compliance with whatever risk management your facility is using on a regular basis. Infection prevention, infection disease, operations, and engineering, the ones that everyone knows we need to have on this team, are the infection preventionists to determine what is our risk to our patients, and the engineering individuals who understand what the building plumbing is and how that building plumbing will work on a regular basis. And then you can have these individuals, Legionella microbiologist, water treatment company. These people will have insight into how to evaluate your system. They're more the experts from the outside. Your water treatment company may have a understanding of your systems to where they can provide for disinfection procedures and things along those lines. But these are optional. If you have them on your team, it is beneficial, but it's not necessary. Essentially, administration, infection prevention, risk management, operations, and engineering are the keys. Now, you can have nursing representation. You can have, other parts of the organization representation can be on that team. If that is the way your team's developed, that's perfectly fine. In fact, more people can provide more insight, but it can be a bigger task to get everyone on board when you go with that. One of the questions I get asked all the time is, well, who's responsible for this, or who needs to write this? Again, that's up to your team and how that's designated. Oftentimes it's risk management, oftentimes it's infection prevention, sometimes it's engineering that holds those. It's whoever's holding that compliance together for your facility is who you would look to be kind of your lead on this team. All right, step 2. Describe the water systems, flow diagrams, and for your potable and non-potable systems within the building. So the designated team then turns around and looks at the cooling towers, the potable water, the whirlpool spas, the decorative fountains, the hydrotherapy pools, those different areas that we talked about as potential sources for Legionella and potential vectors to patients that need to be evaluated for their risk. You got to develop flow diagrams and endpoints of use. I think there was a brief picture of a flow diagram yesterday, which is this one. Now, your flow diagrams are very simple documents. Understanding your water system doesn't come down to knowing where each plumbing pipe goes. It's understanding how the water flows through your facilities. You can do it with text, the written description of, the water comes in through our main, it goes to these tanks. From these tanks, it goes to this loop, and you understand how it goes through. Oftentimes, people find it easier to understand that by having a visual flow chart. And this flow chart starts with your incoming water, goes to your different tanks and facilities parts, and you see how it flows through, and everything ends in the sanitary sewer system. You could also have a vertical line chart like this. It's really just important to understand where it comes through and where it's being distributed to individuals. And the heating and distribution is the key. Where does the water get warmed? Where does it get to a point where it can support growth? And then how does it get to the individuals in the facility to where it could be of a risk? Here's a simple cooling tower diagram. This helps people understand how water moves through a cooling tower. You may or may not have this part of your flow diagrams. It's very helpful to understand what's going on within the cooling tower and where those droplet gets formed into the drift, and where you can check the tower for Legionella proliferation. But maybe it's just an arrow that says, and water goes to the cooling tower at this point. Again, your flow diagrams can be very simple. It's more for understanding instead of knowing exactly where every bit of water is going in your facility at that time. So once you've got your team and you've got your flow diagrams, you go to the real work or the real measurement of the water management plan, and that is steps 3 through 5. 3 through 5 are where you analyze your systems, you evaluate your risk, you develop how you're going to control it, and then you develop how you're going to monitor that. And first and foremost is saying, what systems do we have? We have a cooling tower, we have water, we have 5 hot water tanks, we have 2 return loops, and we need to evaluate the 3 decorative fountains we have on. So what are the risks associated with those? What are the areas in which they get their water, and how does that water proliferate through the system? And what are we going to do about it? And what are we going to do about it is, what are our control measures? The control measures are how we look at preventing or minimizing or limiting our or the proliferation of Legionella within the system. First on those is cooling towers. You're going to use chemical biocides. This is where your water treatment provider comes in and provides that knowledge and expertise. We've seen biocides are typically more effective when they're used in a multi-stage program where there's a continuous feed and there's a individual slug feed that helps to minimize the biofilms and areas of proliferation for Legionella in those. Outside of that, your flow rates along those lines are another ways of controlling what type of water you're putting into that system and where that water is coming from. For potable water, the one that you guys are dealing with on a regular basis, or that has the kind of the bulk of the work, is temperature. Is your typical control measure. You're trying to maintain your temperature so that they are warm, not hot to scald, but they don't sit for long periods of time in that great growth range, so that Legionella proliferates in dead legs or in slow flow areas or in water tanks along those lines. Temperature is not the only way you can control it in a potable water system. You can have a disinfection system. Some people will have secondary disinfection systems, such as monochloramine or copper silver, that is added to the water at the cold water side before it goes to the hot water, to help to eliminate or handle biofilm or proliferation and colonization of Legionella throughout the system. So you can have a biocide in addition to temperature, but temperature is the most common, as biocides is the most common in the other ones. Your whirlpool spas or therapy pools, biocides are maintained on those on a regular basis. There may be state and local guidelines of what those biocides need to be at and what other things you need to test for associated with that, solely for the purposes of maintaining those. The water management plan would address, we're doing these items to be state compliant, but we're going to also use these items as control measures, or these items are significant and effective enough that they are going to be our control measure within the state guidelines. Decorative fountains, biocides are the same main control that you have there. The reason is especially an outdoor decorative fountain or an indoor decorative water fountain, let's say a water wall or something along those lines, the ambient temperature will cause the water that's being maintained in there to get close to grow ranges. Typically, they're only supplied with cold water, and that wouldn't be an issue. But if you have lights in them or they're outdoors, they're going to be exposed to temperatures that'll help that water to be in that grow range. So you'll need some sort of biocide associated with them. So that's your analysis of the building systems and your control measures. And then you develop how you're going to monitor that, which is validation and verification. But to get to that point, you may need some guidelines and regulations that'll help you out. CDC provides for the toolkit that walks you through the steps of developing your water management plan. ASHE and has some guidelines as well for control measures in terms of temperature and flow rates, biocides, for your different water systems in your thing. CDC's water management checklist. In that toolkit, it goes straight through the different areas to help you understand, okay, we're looking at this. Is there disinfection? Have we had water main breaks? Have we had those types of items that we need that are maybe going to cause issues associated with that? Another step in this evaluation is looking at what sort of interruptions we may have. And the big one of those would be construction. And I know we briefly talked about construction yesterday. And as a part of that, the water control, the water infection control risk assessment, the WICRA. Many of you should be very comfortable with an ICRA. A WICRA is a water version of that. So instead of looking at air travel, dust mitigation, dust proliferation through your system, you're looking at when are we having water interruptions associated with new construction, associated with new startups of new areas. You can use the WICRA as you develop your water management plan to help you evaluate where we're going to potentially have issues of our modes of transmission, the water source, the risk areas, and those items that can come. And then once you've gone through and developed your patient susceptibility, their potential exposure, and you've developed the risk for them, you can use that like a regular ICRA in a matrix to let you know where you're going to be at in terms of is there an increased risk and do we need to adjust our water management plan for that. So I'd like to talk briefly about the steps of monitoring. There are 2 points of monitoring before you get to step 6, and that is your verification and validation. And this is the part that I found people really struggled with at the beginning when they first started doing water management plans. Is there's 2 ways that you're evaluating your system. One is your verification, and that is to ensure that whatever your control measure you've chosen, temperature, biocide, flow rate, pressure, to ensure that those items are functioning as intended. Now, that doesn't say that you're controlling your Legionella. That says that you're implementing your plan properly. So I think there was a discussion briefly of temps and flow times. And so temps and flow times is one of the main ways that you were looking at controlling Legionella in your healthcare facility. Temps are monitored on a regular, routine, daily basis, not only at the portable water tanks themselves, but at the distribution points. And the flow times means how long from the point that I turn on that faucet do I reach maximum temperature? And I'm having difficulty with that. Recently did a hospital system, and like many of the hospitals that everyone works in, they built phase 1 in 1950 and phase 2 in 1980 and phase 3 in 99. And then they've had 3 more towers built since then. And their water system was spaghetti, to say the least. In the area that they were having an issue, their flow times to reach max temp were greater than 5 minutes because of how that building had been tied into. So although they were providing water at an appropriate temperature with a good residual disinfectant, it was taking so long for new water, fresh water, to get to that area of the building that you were getting biofilm formation, low pressure flow, and getting issues along those lines. So their verification was telling them, hey, we're not meeting what we need to for our water management plan. And that's where you develop a corrective action based on your verification. The second part of that is validation. Validation is what are we doing to prove that we're handling and controlling our Legionella? How are we managing to do that? And that comes in 2 different forms. ASHRAE 188 and normative Appendix A gave you 2 options to either test or to monitor your patient population for positivity of Legionnaire's disease. You can write either one of those 2 into your water management plan. There are pros and cons to both of them. One, your validation through testing is going to be a kind of a proactive meat to it. Your validation through monitoring and surveillance is going to be a reactive portion to it, but there are costs associated with testing that may be different than the costs associated with monitoring. But verification and validation are how you assess the water management plan to determine if it's working. That goes to step 6, which is where are your corrective actions and how are you doing those corrective actions? Is your program being implemented as designed? That's verification. And is it effectively controlling the hazardous conditions throughout the building? That's validation. You need to have in your water management plan, you need to write down, we are going to do this. And when this doesn't meet this standard, we are going to have these reactions to it. We're going to have our controls implemented with control limits, corrective actions, and control points. Where are we checking the temperatures? Where are we validating the flow times? What are our acceptable limits for those? And when we don't meet those, what are our corrective actions? We're going to monitor those controls on a regular basis. And what is our time frames for those, and how do we go about doing it? And then after you verify and validate, you're going to document. One of the first water management plans I worked on, a facility, rural facility, doing real well, except for they were persistently had a very low level of positivity throughout their potable water system. And in discussions with them, they, being kind of rural, they were at a persistent 75% occupancy. And so their resolution to that was, instead of scattering working and staff out, they would rotate through a closed unit. So they would close a particular unit for a month or so, and then they would reopen that one and close the one below, or close the next one. They had no control action during that time frame. Housekeeping was coming through and doing a light cleanup, but maintenance and water usage were not happening during that time. So essentially, they were establishing their own special giant dead leg that sat for a month, could potentially grow a little bit of Legionella, and then by the time they rotated it through, that was in the system and persistent in the system. So if you flushed out the active areas, you may get that number down, but you weren't able to get rid of it because of that. So in discussions, we determined that the best option was to make sure that water was flowing on a regular basis in those unoccupied shutdown wings. What they did was they added to housekeeping staff's list of duties, put it on their checklist, that when they came into those rooms to do that spruce up, to make sure that they were, no one had gotten into it, or whatever minimal cleaning they were doing while they were down, that they turned on the sink and the shower and they ran them for a designated time. And their documentation of that was to add that to ESD's checklist so that it got marked off. And there was some way to confirm that control, which got added to their water management plan after the first iteration of it, because they were seeing this positivity, became standard, became documented, became verified, and they were able to keep going forward with it. And what they saw is, over a 2 to 3 month period, we did see that minimal positivity decrease and eventually go away. Took a little while, but they were able to do that through that. So the other question is, well, do we just have to make these up on our own? Yes, no, you don't need to. Your verification goes through known norms of what your temps are. We know that at 140, we're going to kill off Legionella virtually instantaneously. At 130 degrees Fahrenheit, we can really limit that growth. That's at the top end of its growth, but it really likes growth in the 120 ranges, and we know we can't deliver above 110 for scalding precautions. So oftentimes we're having very warm water tanks at 140 plus, so that we're killing off the Legionella in there, and then they're going through a mixing valve to get down to that 110. The closer that mixing valve is to the delivery point, the better off you are, because the less run you have of that 110 temperature water that can be an issue. Talked briefly about biocides and cooling towers, and how pump and feed records are the way that you understand that, okay, we are adding this biocide on this frequency as our control measure. Or verification is those pump records and feed records, and are we having that happen? Almost every single time I've had a previously negative cooling tower go positive, it's because of a pump failure. And they would have seen that with regular monitoring of that pump validity, whether it's an electronic notification that the pump is working, or it's a visual inspection that the pump is distributing as it should. Same thing with decorative fountains, whirlpool spas. The verification for that is going to be your pump and feed records of what type of biocide you have and how often they're going in. Your validation control, potable water cooling towers, Legionella sampling, or disease case monitoring. Either one of these have pros and cons, as we discussed. But the question is, okay, I'm sampling. What guideline do I use for positivity? One of the number one questions I always get is, well, everyone says Legionella is everywhere and it's in the potable water and it can increase in my system. So if I test, I'm going to find it 100% of the time because everyone says it's everywhere. Well, what we found is that's not true. The positivity rate for potable water is somewhere between 5 and 10%, meaning that out of every 100 samples I take, I'm only seeing a positivity rate of 5 to 10 of those on a regular basis. There are many systems where we've been doing testing for 15 to 20 years of their potable water systems, and they have never had a positive, or they've had minimal positives associated with specific events, whether it be construction or something along those lines. Previously, you had to determine what your response to a positive sample was going to be. However, the CDC finally did come out with a more definitive statement of what they consider controlled and uncontrolled. You can't really gauge the risk based on your positivity, but you can determine whether or not you are controlling or not controlling your Legionella potential proliferation based on what your routine sampling is telling you. And in this top bar here is the gray line. That's for potable water, or the potable water is the top half of that Legionella routine testing analysis. And what it's telling you is if it's above 10 CFU at any location, and the CDC uses a basically zero tolerance in terms of they're not concerned about how many samples you've taken and what your percent positive is. They're concerned about what is each individual site, and does that each individual site, is it controlled or uncontrolled? Above 10 CFUs per mil in your Legionella samples, you're definitely uncontrolled, and that's going to cause you to take an instant response to that. Between 1 and 10 CFUs, you're in a poorly controlled situation. You're not completely uncontrolled. The CDC is not saying you need to panic, but you need to evaluate what your response to that is going to be. And then if you're below 1, which could be detectable, many labs report out less than 1 CFU per mil, or 0.5 CFU per mil. If you're in that area, you are controlled. It would be a routine maintain what you're doing because you are keeping it controlled. But if you're in that poorly controlled situation, you'll need to figure out whether you're going to do flushing or infection, a shock disinfection, or look at secondary disinfection for your potable water system. That is what you will write that into your water management plan. You'll write, we are going to use Legionella testing on a quarterly basis at 20 sites within our facility. That is our validation step. If any of those sites are positive, above the CDC or your own recommendation of 1 CFU per mil or whatever you determine you want that to be, then we are going to institute an intervention at that location and or associated locations. If you get a positive, you're only doing one sink in a unit 5 West or whatever that unit's called, and you have one sink in there that's positive. Does that mean that every other sink is negative, or does that mean that every other sink is positive? Really, it depends on usage and what's going on. So you may want to write in there that we're going to flush every sink in any affected unit that we look at. That's part of writing down your responses to those controls, developing your responses to those controls. And fortunately, the CDC provides you with this guideline of here's some numerical values that you can look at. The second half, or the lower part of that gray bar that says "or," is for non-potable water, which is your cooling towers. Your non-potable water there, they list uncontrolled as above 100 CFU, and then anything from 10 to 100 is in the poorly controlled. For cooling towers and for non-potable sources, most laboratories will use the limit of detection as 10. So they really won't be reporting that out less than 10. It can be done. You just need to ask your laboratory. In Europe, sometimes they do down to 1 for even for cooling towers. So, but if you're below 10, the CDC is looking at it as controlled. They understand that there may be a little bit of positivity for Legionella in cooling towers and other areas. There's also a little more difficult mechanism of that, getting into the water, getting into the droplets, and then getting to people. So that's why they have a higher threshold value for that. But you write that into your water management plan as well, where our cooling towers are going to be tested, and if we have anything that's above 10 CFU, we are going to reevaluate the biocide that are being applied and ensure that they're being applied, and then possibly do a cooling of the cleaning tower and bring our water treatment professional in for that. That helps to build which goes to the last step, which is documentation. All of this is contingent upon your documentation, writing down what your plan is, what your control measures are, what those verification and validation steps are. And what I see people get dinged on most often is, and what are we going to do if we have a positive? There was a big rush at 188 came out, and people were like, well, hurry up and come and test my system. And I'm like, well, what does your water management plan say? Well, we'll do that later. You can't do that later. This is done before you get to these things. Now, you may have already been testing for quite some time, and you can just write that into your thing. You may have just been evaluating cases and you haven't had any cases, and you're going to keep going forward with that. And that's going to get you to that point where you haven't had any issues, but you have a contingency based on, if we have an issue, we're going to implement the following disinfection procedures and or additional validations associated with that. The documentation is the key. In the response to sample results, we went over that with the CDC. And then the last thing that's not mentioned, step 8, is continuous review. Not only is ASHRAE 188 itself in continuous review as a standard, you need to be doing continuous review of your water management plans. In general, that's an annual reevaluation. You get the whole team together, you sit them down, and you say, here's what we did last year, here's what our validation, here's what our verification said, and here's what our validation said. Do we need to change anything? Did we add anything? Have we determined that there's an unidentified sump pump that's holding water that gets fed into a potential source? So we need to come back and check that at this point. Do we need to, have we built a new unit and we haven't added them to our verification and validation write-up? Did we add some new equipment that is based on water? Have there been any changes? Something that just recently happened in 2023, and we won't really cover it much here, but I can answer questions on it later, or you can always contact me, is ST-108 for critical water, which will affect your SPDs and your sterile processing departments and your dialysis units. There's a new standard which they have to meet. Talked with a hospital and said, hey, have you thought about ST-108? They said, our water management team is together and we're looking to see if we need to add that and what we need to add to meet that standard. So that annual review gets to those. Now, I said, bring the whole team together for your continuous review. One of the questions is, well, when we're doing our routine verification and validation, do I have to call a meeting with, all 10 people and get my Legionella expert, my water management, my water treatment guy in? And no, your routine part of your water management plan is going to really be handled by engineering, infection prevention, and risk. Those people that are, most critical to the development and implementation of it. They're going to be seeing whether it's sample results or verification information, and they're going to be taking that and responding to that based on that. Talk a little bit about other pathogens, CMS. So that's it for how you get to your water management plan and how you get through there. The CMS memorandum, really focused on Legionella, focused everyone on Legionella. The CDC toolkits focused on Legionella, but everyone noted that there are other pathogens that could be a source for outbreaks that need to be addressed by your water management plan. The ones listed in CMS kind of got the spotlight from laboratories because they're listed in CMS. So some people just defaulted to, I only want to look at these 6 items: Pseudomonas, Acinetobacter, Prochlordaria, Stenotrophomonas, NTMs, and fungi. Many other pathogens could be part of your problem. You can ask your laboratory, your environmental laboratory. You shouldn't be doing this through your in-house clinical laboratory. Environmental pathogens look and feel a lot different than clinical pathogens. And so if your clinical laboratory is doing a lot of this, you may want to look at an environmental laboratory to be able to find some of those pathogens a little bit better. They could be reservoirs for these pathogens as well. All your water systems that can sponsor and proliferate Legionella can sponsor and proliferate these other pathogens as well. It's been something that's been discussed of why Legionella is the one that's so important. There's a couple of different reasons for that. One, Legionella is difficult but easy to identify in the environment, in that environmental water. It's a known process to develop, process, and identify Legionella, where some of the other pathogens are going through different methods of different selective augers and things that are unusual and not seen. And since water conditions are very similar for all of them, that's why the focus is on Legionella. However, if you're having an outbreak of one of these, you would want to focus directly on just that, because you could be positive or negative for Legionella and the opposite for Steno or Pseudomonas or any of these other pathogens that are commonly seen in water. You can add to your water management plan validation for other pathogens. There's no reason that your water management plan just says, I'm only testing for Legionella. Legionella is the focus of it, but if you're having an issue, I had one facility for 15 years. They were having a big issue with Elisabethinii, and so they tested every single quarter for Elisabethinii and Legionella because they were having a large problem with it, and they wanted to make sure that they prevented that from becoming a continuous issue. All right. I have made it to the end. Do we have questions? Melissa?
Yeah, thank you so much, George. That was very, very informative. I did want, before we get into the questions, I did want to address just a few things. We had a few folks who hopped on after we had gotten started. And George, can you forward your slide just to the CE credit so people can get that, please? We had a few folks who had trouble yesterday getting their CE certificate generated. We believe that had to do with the dates. We had a date range. Today's the second date. So we believe that you should be able to generate any CE certificates today. There also are some folks who may be having trouble because they're trying to generate this from their phone, which doesn't work as well. However, Sally Sturgeon is the person who we work with for our CE, and she has said if you continue to have trouble after today, to please reach out to her directly. Kirsten, can you put her email address in the chat, please, so that folks can follow up with her if needed?
Yeah.
And another question that we had was about the slides and recordings. We should have the slides and the recordings on our website within 2 weeks, so you should be able to refer back to them if needed. And again, we're going to use this time for any questions. If you have questions, please put them in the Q&A box or raise your hand. And George, I do see one question. It says the presentation seemed to focus on the 2020 ASHRAE guidelines. Last fall in 2023, Standard 514 introduced new requirements. How do those guideline updates differ since they focus beyond Legionella? Some of the recommendations from Legionella mitigation actually proliferate MTNs and other pathogens.
Correct. So the water management program setup focuses back to ASHRAE 188 2021, which is Legionella focused. What is currently going on with ASHRAE now that 514 came out, which 514 takes those 6 pathogens that we talked about and adds, I want to say 3 more to it on a regular basis. There is discussion within ASHRAE to combine those 2 standards along with potentially ASHRAE 12, which deals with other water quality issues, into basically one comprehensive water standard that's ongoing. It's not current. What we and other laboratories have done is we addressed the CMS request when the 6 pathogens came out, and then responded to that when 514 came out and told and pointed you in the direction of other potential pathogens that needed to be added to that list. And again, your water management program can be built whichever way you want. It focuses a lot on Legionella because that's what 188 focuses on. 188 started out solely as a Legionella control standard. But it does look like that 514 and 188 will be combined at some point. They're just not currently combined. One of the issues that we also see, NTMs are the big issue, because although some of your control measures for Legionella can help proliferate NTMs, some of your general conditions that are beneficial to both, ice machines being a big one of these, NTMs have the upper hand in an ice machine versus Legionella because of the cool temperatures and that the NTMs can survive through. So one of the big issues with NTMs is the ones you're most concerned about take 6 to 8 weeks to grow. So you would want to get with your environmental laboratory and see what options they have associated with that. Whether they could do a molecular screen or something along those lines that would be a little bit quicker. It makes it difficult when the Soren heater cooler issue came out. Everyone ran out and started doing NTM sampling specific to the Soren heater coolers, and then we ran into a big stumbling block of, hey, 6 to 8 weeks later, this was positive. And had you been using that one, or did you have to take it out of service during that time frame? So environmental sampling can be very beneficial, but can have some limitations. So it's something that's why it's good to have a microbiologist on your team to understand those limitations and how you want to add that to your water management plan.
Thanks, George. We have another question. This person says that they looked at a document from the CDC website estimating waterborne infectious disease burden by exposure route. And that document seemed to indicate that Pseudomonas healthcare costs were 50% greater than the costs associated with Legionella. So can you confirm Legionella versus Pseudomonas costs?
Can't confirm cost, but Pseudomonas is a little more prevalent and can cause multiple infections, not just Legionnaire's disease or legionellosis. So you're going to have more incidence and rates of Pseudomonas. There's more transmission vectors too. You can get Pseudomonas from a surface. You can get it from the water. You can get it, you can only really get Legionella from airborne inhalation. And so it would make sense that your costs for Pseudomonas are higher than your cost for Legionella because of the potentiality for more infections and more modes of transmission. Now, this kind of goes back to my talk I like to have on construction, airborne and construction aspergillosis, where it's a very small part of, or a very, very small percentage of HAIs, but it's 100% preventable. For Legionella, with a proper water management plan, it is very much close to that 100% preventable in terms of your potable water system and your cooling tower system if you're persistent on it. And so I think that's why it gets the limelight a little bit more than a more infectious, more costly Pseudomonas. Although if you want to say, hey, we want to do a water management program, we're meeting the guidelines and we're looking at our Legionella, but we're also have a big Pseudomonas issue, we're going to look at Pseudomonas as well as part of our water management plan. And we're going to add that validation to it. Your verification is not really going to change. You're going to use temperature. You're going to use your secondary disinfection system. You're going to use those things. You're going to use verification of routine cleaning, surface cleaning as your Pseudomonas verification, and then you can validate with either surface or bulk water testing for Pseudomonas.
Thanks so much. I don't see any other questions right now. We have a couple minutes. If anyone has any, please raise your hand or put that question in. I don't see any other questions right now, George. Thanks so much, George, for presenting with us today. And I'd like to thank everyone for joining us. Again, we'd love to see you at some of our future education events, childhood vaccine webinar, or our 2024 boot camp, which will begin next month. Again, please feel free to reach out to us during our office hours or any other time in the Contact Us tab of our website. If you have any questions, if you're just curious about what we can offer, or if you have any specific issues that you need some help with. Thanks so much again for joining us.
Thank you for having me.